Welcome back to Medicare 101, the video series that talks about the basics of Medicare. I hope you've enjoyed our videos so far, and I hope you've gotten a lot of information as far as how to go through this whole Medicare process. So far, we've pretty much covered everything with Medicare. We've talked about parts A and B with original Medicare. We've talked about how to enroll in those. We've also talked about the two different paths that you can take to supplement that coverage. And we've talked about the Medicare prescription coverage, Part D. We wanted to take some time and just talk about the things in Medicare that if you aren't aware of them, they may cause some issues down the road. In this video, we're going to discuss the most common things to watch out for as you start your Medicare journey, as well as throughout your time enrolled in Medicare. The first pitfall we want to discuss today is Medicare penalties. A lot of people aren't aware that Medicare penalties exist. In fact, pretty much the only mention of Medicare penalties is in a packet that you get when you turn 65 from Social Security. And let's face it, nobody reads those packets anyways. So a lot of people just don't know that these penalties exist. So we wanted to take some time and discuss the Medicare penalties. Medicare penalties apply if you do not enroll in Medicare when you turn 65 or when you become eligible after losing employer coverage. These penalties only apply if you do not have employer or union coverage that is considered creditable. What that means is your employer coverage or your coverage through work is equal to or greater than the coverage offered through Medicare. Now, if you do have employer insurance, then you're most likely okay, but just check with a Medicare professional to make sure that you don't need to go ahead and enroll in Medicare when you turn 65. All these penalties apply to Part A, Part B, and Part D. So original Medicare and then Medicare prescription drug coverage. We're going to break down these penalties just real briefly for you so that you're aware of them, but awareness is really the best way to avoid any of these penalties. First up, you have the Part A penalty. The Part A penalty only applies if you're required to pay for Part A. Most people, if they've worked long enough, they don't have to pay for Part A. The Part A penalty is a 10% penalty. You have to pay the penalty for a number of years equal to twice the number of years you could have enrolled. In other words, if you enroll in Part A when you turn age 67 and you didn't have employer coverage before that, you would have to pay that 10% penalty for 4 years. Next up, we have the Part B penalty. The Part B penalty is a 10% penalty per year that you did not sign up for Medicare Part B. In other words, if you sign up at age 67, you would be looking at a 20% penalty on your Part B premium. Now, one important thing with the Part B penalty is that it is a lifetime penalty. So if you fail to enroll in Part B when you're first eligible, you will pay that penalty for the whole time that you have Part B. Finally, we have the Part D penalty. The Part D penalty is a 1% penalty per month you failed to enroll in Medicare Part D. In other words, if you sign up at age 67, you would be facing a 24% penalty on your Part D premium. Again, this is like the Part B penalty, where you will pay this penalty for the lifetime of your enrollment in Part D. It's very important to be aware of these penalties. Like I said, awareness of these penalties is really the best way to avoid them. When you turn 65 is when your initial enrollment is. Your initial enrollment starts 3 months before your 65th birth month, and continues 3 months after your 65th birth month. So you do have a 7 month window to enroll in Medicare in parts A, part B, part D, so that you can avoid these penalties. If you fail to enroll during that period, unless you have certain circumstances or you have coverage through a job that is creditable, you may face these penalties down the road. Always speak with a Medicare professional to kind of help guide you through this process and help you avoid these penalties. And they can also help you make sure that if you have employer coverage, that it is sufficient coverage to avoid these penalties. The next point I want to discuss today is something I call the Medigap pitfall. Medicare supplement plans, also known as Medigap, can be enrolled in when you first become eligible for Medicare, either at age 65 or after age 65 when you lose creditable coverage. If you enroll during that period, Medigap plans are guaranteed, regardless of any medical history. However, if you choose to enroll in a Medicare Advantage plan when you first enroll in Medicare, or if you change to a Medicare Advantage plan later in your Medicare journey, the Medigap plans are subject to underwriting. What this means is they can look at your medical history and they can say, well, you've had 3 heart attacks in the last 2 years. You're not a good fit for these plans. And they can deny you coverage on the Medigap plans at that point. This is something that we discuss with all of our clients when they're considering enrolling in Medicare Advantage. It doesn't mean Medicare Advantage is not the right fit for you, but what it does mean is it's just something you need to consider when you're enrolling in a Medicare Advantage plan. If you choose to enroll in a Medicare Advantage plan, understand that you might lose the ability to get on a Medicare supplement later down the road. Now, there are some protections in place for people who get on Medicare Advantage if you decide to change to a Medicare supplement later. This is called a free look period or a trial right period. What this is when you get on a Medicare Advantage plan for the first time, you have a 12-month free look period. What that means is you have 12 months. If you choose to go back to original Medicare and a Medicare supplement, you can do that without going through that medical underwriting. You can be guaranteed that Medicare supplement plan. Now, this free look period is only for 12 months. So if you're on a Medicare Advantage plan for longer than 12 months and you choose to go with a Medicare supplement later, you will be subject to that medical underwriting. So this is just something to keep in mind as you're looking at the two paths, whether to go Medicare Advantage or Medicare supplement. It's just something to consider as you're looking at those options. Always talk with your Medicare professional to see what's going to be best for you in your unique situation. This next one is less of a pitfall, but it's really more just something that a lot of our clients get confused on. And that is the Medicare alphabet. Alphabet soup, I like to call it, because all the letters always get mixed up. Medicare is made up of parts. Medicare is made up of parts A, B, C, and D. For some reason, the Medicare supplement plans, when they were created ages ago, decided they would also use the alphabet. So when we're talking about Medicare supplement plans, they are broken down into different plan types, A, B, C, D, E, F, G, and so on. So it's easy to get these mixed up and mixed in with the Medicare parts. Just try to remember, this is the easiest way to remember, that Medicare equals parts and Medigap or Medicare supplement equals plans. So if you hear someone talking about a plan G or a plan K, they're talking about Medicare supplement. If you hear somebody say Part D or Part B, they're talking about actual Medicare. The last pitfall I want to discuss today is online forms and call lists. You may have already fallen into this pit, but when searching online for help with Medicare, there are a plethora of places you can go to fill out a form that says free Medicare information or get free quotes now. Unfortunately, a vast majority of these will get you on a call list. Within minutes, you'll find yourself flooded with calls, texts, and emails trying to get you to buy Medicare policy from them. While there are a few forms that you can fill out online to work with a very specific agent or broker, a majority of them are just information brokers who sell your information to 20 different insurance agencies and try and connect you to the one that's most persistent. The best way to get Medicare information is directly through a .gov website, specifically medicare.gov or ssa.gov/Medicare. If you're looking for a Medicare professional to work with, ask your friends and family who they like to use. You'll likely find someone local that you can meet face to face with, and they will help guide you on your journey. If you fill out an online form, unfortunately, 9 times out of 10, you're going to wind up on those call lists. Now, if you've already filled out a form and wound up on a call list, there are some things to help diminish the impact. It's not a cure-all. It will not fix the problem completely, but there are a couple of things that you can do to help. First off, register your phone number at www.donotcall.gov. Any legitimate agency must use this list to scrub their call list before calling you. If your number is on that donotcall.gov, any legitimate company will run through their list, find your number on there, and take it off. Go ahead and answer as many calls and texts as you are willing with this phrase. Please add me to your do not call or do not contact list. Any legitimate agency must comply, and they must report it to their home office for you to be added to an in-house do not call list. Now, this is not a 100% solution for this, just because there are other agencies out there that don't care about being legitimate and don't care about following these laws that are in place. But the vast majority of people calling you are just brand new agents that don't know any better, but they do know this. They know that they're supposed to scrub these lists. They know that they're supposed to report this, and they will stop calling you. In the end, be kind. Like I said, a vast majority of people calling you are brand new agents that are handed a list and told, here, call these people. This is how you sell insurance. And they just don't know any better. Just reply, please add me to your do not call list. Hang up the phone and leave it at that. I hope you've enjoyed these videos and I hope they've helped you understand Medicare better. I hope they've helped you understand some things to avoid as you're looking at Medicare. But most of all, I hope that this makes your Medicare journey a lot easier. Really and truthfully, the best way to get through this Medicare journey is to work with a Medicare professional face to face. A lot of you may not have access to that, so we want to offer our services to you. If you have any questions or any needs as you are going through this Medicare journey, please feel free to reach out to us. We are happy to help you. If we're not licensed in your area or we're not contracted with carriers in your area, we're happy to help guide you to somebody that is. Again, talk to your friends and family, see if there's someone local. And if there's nobody local, we would love to help you out any way we can. Thank you for taking the time to watch these videos. I wish you the best on your Medicare journey.